What actually defines old age for you? I mean, is it hitting a certain number, like 65 or 70? Or maybe it's more of a feeling, that little twinge when you stand up, perhaps?
Well, maybe it's a life stage, right? Like becoming a grandparent or retiring.
Exactly. It seems like such a simple question on the surface, something we all think we understand.
Mm,
But when you start to really unpack it, you realize this idea has huge implications, especially now, with populations aging all over the world.
absolutely. And this whole concept of old age, it turns out, isn't nearly as fixed or straightforward as we might think. Our perception of it is constantly shifting.
And that shifting perception, it's not just, a personal thing or how different generations see it.
Not at all. It's actually a really critical area of study. Researchers in loads of fields are looking into this gerontology, obviously, but also financial gerontology, political gerontology.
So studying the money side of aging, the political impact.
Yeah, precisely. Because how we define old age impacts everything from pensions to healthcare policy to how older adults participate in society. The big challenge, though, and what makes this so fascinating, is that there's just no universal agreement on when old age actually starts.
No single definition everyone accepts.
Nope. It really varies country to country, culture to culture, even person to person. It's a very elusive idea.
Okay, let's unpack this then. Today we're doing a deep dive into a really fascinating research paper. It's called Being Old in the Age of Aging: Macro-Level Determinants of Change and Perception of Old Age Threshold in EU Countries.
It's by Augustynski and Jurek.
Right. And our mission here is to understand how those big picture society-level factors and the macro stuff in European Union countries influence when people thought old age began, specifically looking at the changes between 2008 and 2018.
So it's not just about the objective facts of aging, but about how we collectively perceive and define it, and crucially, how that definition changed over a decade.
Exactly. How that perception itself evolved.
Yeah.
The elusive definition of old age. So before we get into those big macro factors, we really need to wrestle with this slippery definition of old age itself. It's clear right away it's not just one thing.
Definitely not. The researchers point out there are several different ways it's been defined, which really highlights how complex it is.
Okay, like what? What are some of the ways people try to pin it down?
Well, one way is using biological criteria.
Hmm.
This links old age directly to the physical changes, the consequences of aging on the body.
Things like changes in posture, skin texture getting different, hair going gray or falling out.
Exactly. Or maybe losing a bit of strength, speed, senses like hearing or vision not being quite as sharp.
Yeah.
From this view, old age literally starts when these physical signs become apparent.
It's about the body showing its age, basically.
Right. Then there's a completely different angle, psychological criteria.
So moving from the body to the mind and feelings.
Precisely. This focuses on shifts in personality, attitudes, emotions. Maybe finding it harder to adapt to new things, short-term memory getting a bit fuzzy.
Or maybe tendencies the paper mentions, like becoming more self-centered or conservative, or perhaps overly worried about health.
Yeah, those kinds of internal shifts. It's less about how you look and more about how your mind and emotional state might change with age. A different kind of transformation.
That makes sense too. Our inner world changes as much as our outer one. What about our role in society? Does that play a part?
Absolutely. That brings us to social criteria. Here, old age isn't defined by biology or psychology, but by changes in our social roles.
Okay, example.
The classic one, which the paper highlights, is becoming a grandparent. That's a huge social marker in many cultures.
Right, it signals a new phase in family life, a different role.
Exactly. It signifies a transformation in family relationships, stepping into that elder role, often with different expectations and a different kind of status within the family and community.
It's a societal timestamp, almost.
A very powerful one. And finally, there are the economic criteria.
This must be about work and money.
Yeah, got it. It's often defined by professional deactivation, basically, stopping paid work and wealth decumulation.
Decumulation, meaning spending savings rather than earning.
Right, drawing down on the wealth you've built up. So in this view, old age starts pretty clearly with leaving the workforce, with retirement. It's a very concrete, often institutionally defined boundary.
So biological, psychological, social, economic. It's clear there's no single answer. It's like looking at aging through different lenses.
That's a great way to put it. And what's really fascinating, despite all these ways of trying to define it objectively, is how much personal feelings about when old age begins can vary.
Yeah, the paper has some great examples of that.
It did. Like a teenager might look at a 40-year-old and think, wow, they're ancient.
Well, someone in their 50s or 60s might think 70 is when it really starts.
And then you get someone who's 100, and they might look at an 80-year-old and think they're still rather young, as one researcher put it back in the 90s.
It really highlights how subjective it is. Your own age and experience completely shifts your perspective.
Totally. And this leads to a really crucial concept for this whole discussion. The idea that the old age threshold is socially constructed.
Meaning, it's not some objective fact, but something society kind of builds.
Exactly. It's not universal or fixed. It reflects the specifics of a particular society at a particular time. Like Kenneth Gergen said, we don't just see objective reality, we see it through our senses and our cultural context.
So what's considered old changes depending on where and when you live.
Precisely. It changes because of environmental shifts, societal changes, medical advances, economic conditions. All these things reshape our collective understanding. What was old 50 years ago might not seem old today.
And that changing socially constructed view is exactly what this paper digs into, right?
Yeah.
Trying to find the macro reasons for those shifts in Europe between 2008 and 2018.
That's the core goal. To look beyond individual feelings and find the big societal currents pushing that perception around. 2, micro versus macro.
Unpacking the influences on perception.
Right. So to really get a handle on how we perceive age, academics often distinguish between these macro-level factors, the big societal stuff, and micro-level factors, which are more about individual characteristics.
Okay, like society-wide trends versus personal experiences.
Sort of. Ayalon and colleagues talked about this in 2014. They were trying to figure out how much of the difference in how people categorize age is down to broad sociocultural effects versus just individual differences.
And this ties into bigger theories about life, doesn't it?
It does. There are competing ideas in life course theory. One is the institutionalization approach. This basically argues that the state, through laws, policies, opportunities, constraints, really determines how our lives unfold. That's very macro-focused.
So things like the retirement age law having a big impact.
Exactly. Then you have the individualization approach. This argues that norms and expectations have less power now, and our life course is more about our own individual choices and agency. That puts more weight on the micro level.
Okay, 2 different ways of looking at how our lives are shaped. Now, the paper we're looking at focuses heavily on the macro side, but you're saying we need to understand the micro influences first.
Absolutely. Before we zoom out, we need to understand the factors operating at the individual level that shape how each of us perceives old age. These are the personal things.
Makes sense. So what are some key micro-level factors?
Well, probably the most obvious one is simply age itself. There are clear age-related differences in perception.
How so?
Study after study shows that older people tend to think old age starts later than younger people do.
Right, like the 20-year-old thinking 50 is old, but the 60-year-old pushes it back to 75 or 80.
Precisely. Our perception actually changes as we age. We keep moving the goalposts further out as we get closer to them ourselves.
Is there a psychological reason for that?
Yes, there seems to be. It's linked to something called the age group dissociation effect.
Dissociation, like
Yeah.
distancing yourself.
Exactly. In many modern societies, unfortunately, being labeled old comes with a certain stigma. Modernization processes, ironically, often reduce the traditional power and status of older people.
And there's often that negative association with frailty or illness.
Right. Townsend pointed that out back in the 80s. So, to avoid that stigma, people unconsciously try to create psychological distance between themselves and the old age category.
How do they do that?
2 main ways. One is identifying with younger age groups. This is why your subjective age, how old you feel, is usually lower than your actual chronological age.
That feeling of, I don't feel 60.
Exactly. And that gap between how old you are and how old you feel actually tends to get wider the older you get. It's like a mental buffer.
Interesting. What's the other way?
The other way is just pushing back when you think old age starts. People tend to mentally stretch out their midlife period. Montepere and Lackman called it a kind of defensive denial.
So you stay middle-aged in your head for longer to avoid feeling old.
Pretty much. It's a way to cope with the negative associations.
Okay, so age itself is a big factor. What about gender? Are there differences there?
Yes, consistently. Research shows gender-related differences. Generally, women report that old age starts later than men do.
Any idea why?
One theory is that women might perceive more age-related discrimination, maybe leading to higher anxiety about aging, so they psychologically push the threshold back further.
But there's a flip side, isn't there? Doesn't society sometimes view women as aging earlier?
Yes, that's the paradox. The threshold is often seen by others as happening earlier for women. This might be linked to different social timelines, things like retirement or widowhood historically happening earlier on average for women, which influences perception.
Complex. Okay, age, gender.
Yeah.
What else influences our personal view?
A really crucial one is socioeconomic status, or SES.
So income, education, job type.
Right. And the finding here is pretty consistent. People with lower SES tend to believe old age starts earlier.
Why would that be?
It could be objective factors. Maybe they started physically demanding work earlier, experienced key life transitions sooner, or unfortunately have shorter life expectancies.
Or maybe psychological reasons, like the impact of disadvantage.
Yes, Barrett suggested that in 2003, the psychological toll of disadvantage can certainly play a role. If life's been harder, you might feel older sooner.
And conversely, people with higher SES.
They often experience life stages later, start careers later, marry later, retire later. This tends to push back their perception of when subsequent stages, including old age, begin.
Plus, generally better health and longer life expectancy.
Exactly. That all combines to reinforce a later perceived threshold for old age among higher SES groups.
So these microfactors clearly show a lot of variation within a country, but the focus of this paper is different, right? It's about the differences between countries and the macro drivers.
Precisely. While those micro differences are well studied, fewer studies have really focused on international differences or the big country-level factors. We have some snapshots, though.
Like the Eurobarometer survey you mentioned.
Right. From 2012, it found that average of 63.9 years across 27 EU countries, but a big range over 70 in the Netherlands, under 58 in Slovakia.
And IPSOS found something similar globally.
Yeah, in 2018, an average of 66, but Spain was way up at 74, Saudi Arabia down at 55. Huge variation.
But didn't earlier research suggest these country-level differences weren't that important?
That's the crucial point. Ayalon et al.'s 2014 study, using earlier data, concluded that only about 5.7% of the variation in perceiving old age was due to macro-level country differences. They basically said individual differences mattered much more.
Only 5.7%. That sounds tiny.
It does, and that's where this Augustynski and Jurek paper comes in. They're not just looking at the level of perception at one point in time, like Ayalon mostly did. They're focusing on the change in perception over a decade.
The dynamics, how it shifted.
Exactly. They argue that understanding the change might reveal a stronger role for those macro factors. They're trying to fill that gap and see what drives the evolution of this perception across countries. 3. The deep dive into macro-level determinants, methodology, and findings.
Okay, so let's get into the nuts and bolts of how Augustynski and Jurek actually did this. What was their methodology?
They based their analysis on the European Social Survey, or ESS. Specifically, they used data from round 4 in 2008 and round 9 in 2018.
And the ESS is pretty well respected, right? Good for comparing across countries.
Very much so. It's an academically driven survey conducted every 2 years, and they put a huge amount of effort into making the methodology rigorous and comparable across different nations, things like sampling, questionnaire translation. It's designed for this kind of cross-national work.
How many countries and people were involved?
The number of countries varied a bit depending on the specific data point, but generally between 8 and 24 countries. The sample sizes were large, over 48,000 people in 2008, over 42,000 in 2018.
But the key thing was looking at the change over time.
Exactly. For analyzing the change dynamics, they focused on the 22 countries where they had consistent data for both 2008 and 2018. That allowed them to track how things evolved over that 10-year span within the same set of countries.
And what were they actually measuring? What was the dependent variable, as researchers say?
They had 3 main ones. First, the average perceived old age threshold in each country in 2008. Second, the average threshold in 2018. And third, this is the crucial one for the change analysis, the difference between those 2 averages for each country.
So literally measuring how much the average perception shifted in each place.
Precisely. That difference score captured the evolution they wanted to explain.
Okay, so what factors did they think might explain that change? What were the independent variables?
They grouped them into 4 main categories of macro-level factors. First up were health factors.
Like life expectancy.
Yes, life expectancy at birth, LE0, and also life expectancy at age 65, LE65. Plus, they looked at the expected number of years people would spend in retirement for both men and women.
And the thinking was better health, longer lives might push back the perception of old age.
That was the hypothesis. Makes sense, right? Data came from reliable sources like World Population Prospects and the OECD.
Okay, health factors. What was the second group?
Socio-economic factors. This was about capturing a country's overall prosperity and quality of life.
So things like GDP.
GDP per capita, yeah, to measure standard of living.
Hmm.
And also the Human Development Index, the HDI, as a broader measure of quality of life, health, education, income combined.
Hypothesis here. Richer countries, better quality of life leads to later perceived old age.
Exactly. Data for this came from the World Bank.
Got it. Third group.
Institutional factors. This was mainly focused on the official legal retirement age for men and women.
Because that sets a kind of official benchmark for when old age begins, institutionally speaking.
Right. It's an arbitrary line, maybe, but it's a powerful social signal. They got this data from trading economics.
Makes sense. And the fourth group, you hinted this might be important?
Yes, labor market factors. And they looked at quite a few indicators here. The employment rate for people aged 55-64.
So those approaching traditional retirement.
Right. And also labor force participation rates for older groups. 65, 69, 70, 74, and even 75 plus.
Why look at the actual employment, not just the official retirement age?
Because the thinking is, beyond the law, what actually happens in the labor market matters. How active are older people really? There's that quote from Blau back in 1956. Retirement implies a social judgment that the person has become old.
So if more older people are visibly working, maybe society stops associating them with being old.
That's the idea. More activity pushes back the perception. This data came from OECD statistics.
Okay, so 4 big categories: health, socio-economic, institutional, labor market. With all that set up, what did they actually find about how perceptions changed?
The results on the changes are really striking. First, the overall shift. Across those 22 EU countries, the average perceived old age threshold went up by more than 5 years in just that decade.
Wow, 5 years. From what to what?
From an average of 63.3 years in 2008 up to 68.5 years in 2018. That's a significant jump across the board.
But you said earlier it wasn't the same everywhere.
Not at all. There was huge country variation. The biggest increase was in the UK. Perception there shifted later by almost 10 years, 9.8 years.
Nearly a decade added to perceived not old yet time. Incredibly.
Isn't it? Latvia was next with 8.9 years, Ireland with 8.5, but at the other end, Croatia barely changed, just 0.9 years. Slovenia saw a 1.7-year increase, Poland 2.2 years.
So massive differences in how much the perception shifted. Some countries lead forward, others barely nudged.
Exactly, and that leads directly to this intriguing paradox they talk about, which they show in their figure 1.
Okay, what's the paradox? This sounds interesting.
Well, it's this. Within countries, people's ideas about when old age starts actually became more similar over the decade. The variation, the standard deviation, decreased. So people within, say, Germany were more likely to agree on a threshold in 2018 than in 2008.
Okay, convergence within countries. So what's the paradox?
The paradox is that between countries, the opposite happened. The gap between the countries with the highest average threshold and the lowest average threshold actually increased. It went from a 6.5-year range in 2008 to a 10.7-year range in 2018.
Hold on. So people inside Germany agreed more with each other, but Germany as a whole drifted further apart from, say, Slovakia in terms of their average view.
You've got it. Diversification between countries increased. The authors call this odd because you'd normally expect convergence as EU countries become more integrated economically and socially.
Yeah, you'd think attitudes might become more similar, not more different.
Right. But on this specific perception, they diverged. And it's because of that unequal increase we just talked about. Some countries shifted their perception much faster and further than others, widening the gap between them.
Fascinating. So to understand why this happened, we need to look at how those macro factors themselves changed over the decade, right?
Exactly. We need to see what happened with health, the economy, retirement ages, and labor markets between 2008 and 2018.
Okay, let's break those down. What changed in health factors?
Good news mostly. Life expectancy at birth went up by an average of 2.2 years across the countries, and life expectancy at 65 increased by about 1.3 years.
So people were living longer and expected to live longer even once they hit 65.
Correct. Interestingly, the gains were generally bigger in Central and Eastern European countries, maybe a catch-up effect from a lower starting point.
What about years in retirement?
A slight average increase for men, about 0.3 years, but actually a slight decrease for women, about 0.1 years on average, likely reflecting changes in retirement ages and work patterns.
Okay. What about socioeconomic factors? Did countries get richer?
Generally, yes. The Human Development Index, that broad quality of life measure, went up slightly on average. GDP per capita also increased by over $2,500 on average.
Any standouts?
Ireland saw a huge GDP per capita jump, over $19,000. But it wasn't universal. Cyprus and Finland actually saw slight decreases, so mixed economic fortunes.
Right. And institutional factors of retirement age, did that go up?
Generally, yes, largely due to reforms after the financial crisis around 2007-09. Countries needed to shore up finances.
Who saw the biggest jumps?
For men, France and Slovenia both increased the official age by 2 years. For women, the UK had a big 5-year increase, Czechia over 3 years. But some countries later rolled back or eased these changes, like Poland and the Netherlands. So it was dynamic.
And finally, the labor market factors.
Yeah.
What happened with older workers' employment?
This saw some really big shifts. Employment for the 55-64 age group went up significantly in every single country studied. The average increase was almost 12 percentage points.
Wow, a universal trend towards working longer in that pre-retirement group.
Definitely. Huge increases in places like Hungary, Germany, the Netherlands. For the older groups, 65 plus, the picture was more varied. Some countries saw decreases, but others like Estonia, Germany, Lithuania saw notable increases in participation, even among the 65-74 age groups.
Okay, so we've got the context. Perception shifted unevenly, and health, economy, retirement ages, and especially labor markets were all changing too, but also unevenly across countries. Now, the million-dollar question. Which of these macro factors actually explained the change in perception?
Right. This is where their statistical analysis comes in, trying to connect those changes. What drove the shift in perceiving old age?
So what did the regressions and correlations show? Let's start with health. Did living longer make people feel old later?
Sort of, but it's nuanced. The level of life expectancy at 65 back in 2008 was significant. It explained about 5% of the change in perception then, growing to 15% by 2018.
Meaning countries where people already lived longer at 65 in 2008 saw a bigger increase in the perceived old age threshold over the next decade.
Exactly. A better baseline health situation predicted a bigger future shift in perception. But interestingly, the actual increase in life expectancy over the decade wasn't statistically significant on its own. Maybe the change was too small relative to the starting point.
Okay. What about socioeconomic factors? Did money matter?
Yes. The level of GDP per capita in 2008 explained 5% of the change, rising to 14% by 2018. So richer countries tended to see bigger delays in perceived old age.
And did getting richer matter too?
It did. The rise in GDP per capita over the decade also had a significant effect, explaining about 13% of the change in perception. So both starting wealth and economic growth seemed to push back the idea of old.
That makes intuitive sense. Prosperity influencing outlook. What about institutional factors, the retirement age laws?
This was interesting. Only one factor was statistically significant here: the official retirement age for women back in 2008.
Just for women. And just the starting point, not the change.
Right. A higher retirement age for women in 2008 explained a surprising 22% of the subsequent change in the overall old age perception threshold. It suggests that setting a higher bar for women's working lives back then had a lasting impact on societal views.
Huh. Specific. Okay, now for the big one. Labor market factors. You said these were crucial.
They really were. And here's a counterintuitive finding first. The actual employment levels in 2008 didn't significantly predict the perception level in 2008.
So just knowing how many 6-year-olds were working didn't immediately tell you how old people thought old was right then.
Correct. But, and this is the key finding, there was a very high positive correlation between the change in perception over the decade and the levels of employment back in 2008.
Say that again. The starting level of employment predicted the future change in perception.
Yes. Specifically, the 2008 employment rate for the 55-64 group had a huge correlation, 0.72, with the change in perception. The 65-69 participation rate in 2008 also had a strong link.
0.50.
So countries where more older people were already working in 2008 were the ones where the idea of old got pushed back the most over the next 10 years.
Precisely. A strong baseline of older worker participation paved the way for a bigger shift in thinking. It normalized continued work.
Wow. And was there anything about the change in labor market factors? Absolutely. A really striking finding. There was a significant correlation, 0.71, between the change in the 75-plus labor force participation rate and the change in the perception of the old age threshold.
So actually seeing more people over 75 working directly translated into society, pushing back its definition of old age.
That's what the data strongly suggests. It wasn't just the potential retirees, but the actual increase in participation among the very oldest workers that had a powerful impact on shifting perceptions. This link was confirmed again in 2018. It seems seeing is believing when it comes to redefining old age through work. 4. The so what? implications, and future directions.
Okay, so let's boil this down. What does this all really mean? This deep dive seems to show that our idea of old isn't fixed at all. It's this fluid, social-built concept,
Hmm.
and it's powerfully shaped by the economy, by societal attitudes, but maybe most importantly, by what's actually happening with older people in the workplace.
You've nailed it. It's less about the number on your birthday cake and much more about what society expects and, crucially, enables people to do as they get older.
And the biggest takeaway seems to be the power of the labor market, right?
Absolutely. That's the most notable finding here. Factors related to the labor market seem to be the primary macro determinant driving how the perception of old age changes over time.
Why is that so important?
Well, think about it from a policy perspective. Micro factors like your personal health or personality, they definitely influence your individual perception, but they're hard for policy to change directly, right? They're
Mhm.
sort of external.
Yeah, you can't legislate someone's personality.
Exactly. But macro factors, especially things influenced by policy like labor market conditions, seem to be the main channel, maybe the only real channel, for influencing this collective perception threshold. It really supports the idea that policy matters in shaping how we socially construct aging, as Hendrik suggested years ago.
So if we want to change how society views aging, policy is the key lever, particularly labor market policy.
That's what this research strongly points towards. The most effective tools seem to be policies that actively support employment for people aged 55 plus, and perhaps especially, based on these findings, those aged 75 plus.
And that feels even more relevant now, maybe thinking about things like the pandemic.
Definitely. The paper touches on the COVID context briefly. Older people were hit hard, not just health-wise, but often job-wise too. Sometimes they were seen as easier to let go because of pension rights.
Which reinforces their vulnerability in the labor market.
Right, and it highlights why employment support is so vital, not just for their finances, but for how society perceives their capabilities and contribution. And it clarifies something really important. It seems it's not just the legal retirement age, the regulations on paper, but the actual employment status, are older people working or not, that really shapes the perception.
So the reality on the ground matters more than the law.
It appears so. When more people near or past traditional retirement age are visibly employed, they stop being automatically associated with old age stereotypes like passivity or withdrawal.
They're just working adults who happen to be older.
Exactly. Their activity extends the mental boundary of adulthood and pushes back the perceived start of old age. It redefines the norm through action.
Which really makes the case for active aging policies, doesn't it? It's not just about economics, it changes minds.
Precisely. Implementing active aging policies has those socio-economic benefits, productivity, tax base, etc. But this suggests it also fosters a more positive mentality towards old age itself. It means we really need to keep working on improving the labor market situation for mature workers.
And the study did confirm that broader economic factors like GDP matter too.
Yes, the effect of economic factors was confirmed, supporting some previous research like Ayalon's and contrasting with others like Abrams's. The link between economic growth and a later perception of old age seems robust in this analysis, focusing on the change over time.
So what were the big strengths the authors highlighted?
Their main one was analyzing the dynamics, being the first, they believe, to really focus on the causes for the change in perception over time across countries, and identifying that paradox we talked about.
Convergence within countries, divergence between them.
Right, caused by those uneven rates of change in perception.
Now, limitations. Every study has them.
Of course. They mention challenges with macro data availability, the fact that theory in this specific area is still developing, and critically, the lack of international longitudinal panel studies.
Meaning studies that follow the exact same people over many years across different countries.
Exactly. That kind of data would allow for even more precise conclusions about how individual perceptions change within changing macro contexts. So definitely room for more research, especially fine-tuning the analysis of specific labor market policies and economic nuances.
So wrapping this up, our deep dive really shows that when old age begins isn't some fixed biological fact. It's a moving target, a social idea, heavily influenced by economic opportunity and how society views older workers' roles.
It's about what we expect and what we enable people to do throughout their lives.
It really shifts the focus.
It does. And it leaves us with a pretty big question, doesn't it? If our societies do continue to extend working lives, improve health, and genuinely support active aging, what will the new old look like in the coming decades?
And how might that fundamentally reshape everything, our social structures, our policies, even how we see ourselves across the entire lifespan?
A fascinating thought to ponder.
Indeed. Truly a fascinating and essential question for our future. Thank you for joining us on this deep dive.